Régine. I'd like to thank you so much for accepting to have an interview on this series called Coast to Coast, to give other dermatologists an idea of how our practice differs throughout the country and what concerns we share and what the CDA can do to help people going forward. So, Régine, tell me, how did you end up in dermatology in the first place?
Oh, great. Well, thank you very much for having me today. It's an interesting story how I ended up in dermatology. It's not sort of the traditional ways, but I think it really reflects on how amazing a good mentor can be and how they can direct you in the right way. So at a very early age, I was working in the lab of a professor of rheumatology by the name of Marvin Fritzler. Now, for those of you in Alberta, you'd know Marvin Fritzler as a guru of autoantibodies and really has become internationally recognized in the field. And so he kind of cultivated me at that very young age. And, one day I said to him, so what do you think I should do when I go into medical school? And he threw me a curveball because he said, well, you know what? I think you should go into dermatology. And at the time I thought, why is he saying this? Does he think I'm so bad that I shouldn't do rheumatology? That was my first instinct. But, he sort of clarified that he thought dermatology was an area of tremendous scientific opportunity. And he thought that I had the ability to do something good in the field. So I thought, okay, I had never considered dermatology. I had always been sort of gunning towards a path in internal medicine or possibly rheumatology. So I said, okay, well, let me see how that goes. And I decided to book a couple of electives. And I was so fortunate that my first elective was with a brilliant clinical dermatologist by the name of Dr. Tom Enta. Now, Dr. Enta has passed away now, but when I saw him, the skill, the ease at which he came up with diagnoses that had huge impacts on patients, I was just taken, aback. And I thought, wow, this is one of the most amazing fields I've ever been in. Then I got to work with Stuart Adams, who is still working and is one of our more brilliant senior dermatologists in Calgary now. And I just said, I love this. This is the most amazing specialty I could ever get into. And so it's really actually an internist who told me to go into dermatology. It's not something I had ever thought I would actually do, but best choice I ever made because I love being a dermatologist and I'm so grateful to be one every day.
Well, thanks for doing so because you've upped the bar on academic dermatology for us across Canada, and your work in bullous diseases is quite amazing.
Oh,
so that's great.
Thank you.
Yeah. And so where did you get your training on the bullous disease subsequently?
So then I went on and I actually did medical school at the U of C. And then when I graduated, I went to Toronto. And that's where I did my 5-year residency program. That went on afterwards, the 5 years, to do a CIHR postdoctoral fellowship for 4 years, and then was recruited back to Alberta, which was home for me. So a little bit of a long and winding road, but I still managed to do it all and to do it fairly quickly. I was done dermatology by the age of 27. So I had time there to do a postdoctoral fellowship, and that's when I really focused in on 2 areas, actually. I focused in on both immunodermatology and medical genetics. So I had a passion for both.
Right, good. And how does it work in your department of dermatology in Calgary?
So in Calgary, we have, we're quite a big division of dermatology. We have actually over 30 members. And the majority of our members are community-based, but we have 7 faculty members who are AMHSP, which is basically salaried clinicians. And so we all have our own job descriptions. Mine is that of a clinician investigator. So 50% of my time is spent on research. As you know, I do a lot of administration. I'm chair for dermatology for the section of dermatology in Calgary at the moment, and I'm also chair of the Royal College for the specialty committee. So I do research, I do clinical, and I do some administration there as well. got it all.
Yeah. So within your group, you have other people that specialize in particular areas also?
We do. We're very fortunate. We have a lot of specialty clinics in Calgary. So we have brilliant people like Dr. Lori Parsons, who does contact dermatitis and wound care. We have Dr. Lynn Robertson, who has expertise in pigmented lesions. We have Dr. Habib Kurwa, who does our cutaneous oncology clinics, as well as Mohs micrographic surgery. We have Jory Harden, Dr. Jory Harden, who does our cutaneous lymphoma clinics and also does several outreach clinics. And yeah, and Dr. Ramin is our brilliant pediatric dermatologist. But I have to say, we have many specialty clinics in the community as well that just sort of work so well with the university-based clinics, and we're really quite a collaborative and cohesive team.
That's wonderful. That's a message I've gotten in other cities too, where they implicate the community dermatologists and value their role also, which is wonderful.
Yeah.
And do you have challenges practicing dermatology in Alberta? Do you have long waiting lists and other people acting as dermatologists in the community that are not board certified?
Yeah. So, in Alberta, we have I have to get the exact number, over 60 very talented dermatologists. I think there are some challenges in the sense that the majority of these dermatologists are in larger urban centers. So what that does mean is that we don't have as much representation as maybe we'd like to have in the community, in the rural communities. Having said that, I think COVID-19 basically catapulted us all into virtual care. And so in a way, this has helped us really be able to service some of the otherwise underserviced populations, like the rural populations. Our wait times in the larger centers aren't too bad anymore, because we do have so many young dermatologists joining our crew. But I think in some of the more rural communities, we still have some issues. There's no doubt that I think over the years, the burden of care on dermatologists has changed quite substantially. We're not only treating sort of skin cancer and skin disease, but we're treating all the healthy skin issues. And so what that's happened is that we have seen an increased number of certification programs out there for skincare, and these certification programs have, I think, I would say, variable training standards, and they don't always have similar certifying examinations. And so a problem that we do face in dermatology is that these standards are not equal, and yet they're really indistinguishable to the public. So the public doesn't always know who they're getting. What that's I guess what's come out of that is that we've definitely seen some issues with appropriate utilization of resources. We've seen some misdiagnoses, and this is something that I don't think is unique to Alberta, but we're seeing it in many provinces across the country.
Right. Certainly needs to be documented and
Absolutely.
can be acted upon. And do you tell me what sort of patients do you tend to see, and what are the pros and cons of the kinds of patients you see? Do you have any stories in that regard?
Yeah, well, there's this funny story that I always tell, which kind of explains a little bit, or puts it in perspective as to what I do as a dermatologist. I see primarily complex medical dermatology. I see immunodermatology patients, so patients with autoimmune blistering diseases, connective tissue diseases, and my other area of expertise is in transplant dermatology. I don't see much general dermatology anymore, but I always laugh because I remember the very first year I came in Calgary, and that dates me because it was 2004. But I remember that I was called to assess a patient in the burn unit at the Foothills Hospital. And this was a patient who had severe pemphigus, who had failed all sort of standard or conventional therapies, even which I almost never use, but extracorporeal photopheresis. Calgary is a site that can do that, and so failed everything. And so one of my colleagues in Edmonton, a professor by the name of Dr. Tom Salapak, had actually published, and I think it is the first case report of rituximab, so a B-cell depletion therapy in the treatment of severe life-threatening pemphigus. So knowing I really didn't have many other options for this patient, I used for the very first time, rituximab. And for those of you who know me, know I've used thousands of, I've given thousands of patients rituximab since that time. But I watched this patient go from basically a burn victim to a man who became completely revitalized, regained his life, left the burn unit, and did amazingly well. So then 10 years later, I get a referral for the same individual. And I think, oh my gosh, maybe his pemphigus came back. I better see him right away because he had probably the worst pemphigus I had ever seen. So he comes back to my clinic and I said, so how are you? How's your pemphigus? He's like, oh, that's not a problem. I'm in remission. I haven't had any more issues with it. I'm doing fine. But I'm really troubled by these broken vessels, so telangiectasias, and I have some crow's feet. And I'm like, well, okay, but that's fantastic that your pemphigus is in remission. I'm so happy to hear that. But I really can't help you with this because this isn't the kind of dermatology that I practice. So he promptly told me, well, you know what do you mean? And I said to him, well, I'll have to refer you to a cosmetic dermatologist. I don't do this kind of stuff. You don't want me doing this kind of stuff. And he said, well, what use are you as a dermatologist? So that's the first time, and probably won't be the last, that I was actually called a useless dermatologist. So there you go. My specialty of complex medical dermatology and transplant dermatology, but I am a useless dermatologist.
Everything in life, it takes a perspective, and each person has their own things. And
Absolutely.
how does it go for teaching dermatology as well as, teaching within dermatology as well as medical students and family practitioners? How does that work for you guys in Alberta?
Yep. So, I mean, I can certainly speak on behalf of my group. The academic group, we're involved in teaching everyone. We're intricately involved in the undergraduate medical curriculum, but we're also involved in teaching postgraduate fellows and that, or postgraduate residents, but that not only involves family medicine residents, internal medicine residents, plastic residents, obviously dermatology residents, and we have some fellows as well. And the community, really, they take their part in all of this too. They're frequently bringing in learners into the community clinics. Obviously, it's been a bit more challenging recently with COVID, but we found all sorts of innovative ways to do our teaching, and that's been great. And I think, it's funny because I look back and it's hard to believe that I've been teaching and in this sort of position for more than 20 years now. But it's been really wonderful and amazing experience for me to be able to teach both our medical students as well as our residents.
Well, looking at you now, we see that you started when you were a baby.
I don't know about that.
That's great. And so tell me how you found involvement in the CDA over the years. Has that been pivotal for you, and what has the CDA been able to bring to you?
Oh, maybe the right question, what has it not brought to me? Because I think it's brought to me something at every stage of my training. So looking at it now, certainly as a dermatologist, it's playing such an important role for education and scholarship, whether that's just learning from the annual CDA conferences or whether it's learning at the Women in Leadership forums. We do these online journal clubs, and I'm fortunate to have the editor-in-chief, Dr. Kirk Barber, based out of Calgary. So he's often hosting our online journal clubs. We have some amazing lecture series that I think all of us as faculty can benefit from, such as a skin diversity series. So huge role just in the educational platform, but not just at the dermatologist level, but also at the resident level. There have been all these great initiatives with podcasts and series for resident education training very helpful for me in my capacity now as chair of the specialty committee for the Royal College of Physicians and Surgeons of Canada. We always have our National Specialty Society observer on those meetings, bringing us input. And when we went through a large in-depth review, the CDA was right there helping us with the survey they did, looking at the future of dermatology, and that provided such tremendous insight as we sort of developed a new curriculum and implemented competence by design for our residents. But it also does an amazing job at just interfacing with the media and helping our patients and the public, whether it's through the upcoming National Sun Awareness Month or through some of the major position statements. For instance, an example of that would just be what to do when you're on biologics with COVID and COVID vaccines, all these sorts of things, huge role. And then I guess just the role the CDA has played in creating some really important initiatives. One that is very close to my heart is certainly with Compagnie Belté and bringing Compagnie Belté out west to Bragg Creek. The CDA was really instrumental in those early stages, and just can't think of a better way to help children with severe skin disease just to enjoy a magical summer.
Right.
So the CDA has done such amazing things, and I think we are so fortunate as dermatologists to have been able to and to be able to work alongside such a wonderful specialty society.
Great. Well, that's good to hear. And I wanted, speaking of specialty society, do you have a group within Alberta itself? So do you get together with Edmonton sometimes also?
We do. About twice a year, we have our Alberta Dermatologic Society that meets, and different things can happen. Sometimes we have patient presentations. Sometimes it's about bringing lectures in, but a big part of it is for us to get together to kind of know what's happening and keeping, I think, informed on all the events related to dermatology in the province.
Right. Okay. And do you have any tips, Régine, for somebody starting off in dermatology now?
So I think those who know me will say that there's something I always preach, and I hope that I practice it as well, but I definitely preach it. I've always said, and I strongly believe that it's an honor and a privilege to be a dermatologist, and that there's only one thing that we need to do, and that is to do right by the patient. And so at every clinic, I will tell the residents, you have one thing to do in the clinic, and that's do right by the patient. So that involves, or that means respecting the patient, showing empathy to the patient, being conscientious with the patient, being collaborative with the patient, most importantly, listening and putting their needs ahead of ours. So that's my mantra. Whether everyone would agree, I don't know, but for me, it's all about doing right by the patient.
Right, right. It's a change in medical practice where I think, years ago, the doctor waltzed in and said what he thought, and the patient just had to swallow it. And now we do work more collaboratively with our patients, and it's I think it's a great reminder every day to think about the patient's point of view and be sensitive to their needs and their questions. And we can't ask ourselves that enough. So I think that's a great recommendation. And it reflects well on the person that you are, Régine, to be so thoughtful of others as well. So I think it's great.
So thank you.
Yeah. Anything else that you'd like to share with your colleagues across Canada before we wind up?
Just harping on the same thing, we're just so fortunate to be in the profession that we're in, that we always have to remember what the priorities are, and the priorities are the patient more than anything else. And to be grateful, I think, that we have such an amazing specialty society in the CDA that supports us at all stages of our training and supports us, supports our patients, and supports our community. So thank you. Thank you.
Super. Well, thank you for your time, and have a great evening.
You too. Thanks again.
Thanks. Thanks.